Quest. How many doctors are measuring insulin? Probably less than 1% of the lab.
Quest is the testing
company. Yeah, the questing company, yeah. Like less than 1% get measurements for insulin, which is the single biggest thing we have a problem with in America, which is our insulin levels are spiking because of sugar. Insulin, when it's high, causes you to store belly fat. It makes you hungry. It locks the fat in your fat cells and it slows your metabolism. So you're screwed. And you get stuck in this vicious cycle where you have hungry fat that makes you eat more, that makes you want to exercise less, and you get in this cycle of weight gain. Nobody wakes up every day and go, I want to be diabetic, I want to be overweight, I want to gain. Nobody says that.
People do wake up craving sugar cereal and pancakes.
Exactly, because their metabolism and biochemistry has been hijacked by the food industry.
Well, how long does it take to get out of that cycle?
Very quick. Very quick.
Like how quick?
Well,
let's say you're on a typical American diet and you're waking up with Frosted Flakes.
Yeah.
Hitting some kind of big sandwich and then having pasta for dinner. You're doing that for 10 years. How long does it take you to get out of the cycle?
I actually done this with my patients for decades, and I created a program called the 10-day detox diet. And essentially it's 10 days of treating food addiction. And I wrote a book about it called the 10-day detox diet. I have an online program starting actually in January. People can go to 10daydetox.com, and essentially it guides people through how to reset your biochemistry, your hormones, your gut microbiome, your metabolism very quickly through food. So one of these patients I had in Cleveland Clinic, she started the program, and in 3 days she was off her insulin. So the cravings go away in 2 or 3 days. You feel shitty for 2 or 3 days, and then you start reducing symptoms. And what happens is when you take out the bad stuff and put in the good stuff, you see changes across your whole system. Because when I talk about food as a root cause, it's root cause for so many of the things people are suffering from. So depression and autoimmune diseases and gut issues. And anger. I mean, yeah, it's amazing. And we know
sugar causes anger.
Yes, actually the data on this is
that?
Pretty interesting. So the amygdala is the reptile brain, fight or flight. It's your reptilian lizard brain. We all have one.
Yeah.
And we have a frontal lobe, which is the grown-up in the room.
Yeah.
So you've got the reptile kind of, and you've got the grown-up. The communication there is important. So when you're walking down the street and you see if a beautiful woman, you say, gee, I'd like to kiss that woman. You don't do it because it's not a good idea for your marriage, right?
Yeah.
Right. You have the frontal lobe going, oh, that's probably not a good idea. Or, gee, I like that car over there. I want to just take that car. And my car was stolen from my driveway 2 days ago. It was crazy, but that's another story. But people don't have control over their behavior because the amygdala and the frontal lobe communication is interrupted by inflammation. Inflammation in the brain is the root cause of so many brain issues. So depression is inflammation, autism is inflammation, ADD is inflammation, Alzheimer's is inflammation of the brain. And Chris Palmer is a Harvard psychiatrist who wrote a book called Brain Energy talking about this and how he cured schizophrenia using a ketogenic diet, getting people off of sugar.
Curing schizophrenia?
Yes. So we have I'm saying these things that sound like crazy, heretical. We can reverse Alzheimer's, reverse diabetes.
Well, they are heretical.
Yeah,
by definition, they're heretical. It doesn't mean they're crazy, though.
No, I mean, the science is there. It's like if you actually look online, there's a National Library of Medicine database called PubMed. Anybody can search it. And you can look at these things and you can look them up. They're online. There's studies done. There's plenty of studies, but they don't translate into...
So it sounds like you said so far the ketogenic diet can cure...
diabetes, Alzheimer's, cancer. Yeah.
And now schizophrenia.
Schizophrenia, yeah.
So will you describe the ketogenic diet just to be...
Yeah, sure. So basically, this is something that was developed for epilepsy years ago because when no drugs work for epilepsy, neurologists realized that if they put people on a diet where their brain was just running on ketones, which is the fuel instead of sugar that the body can run on. Remember I said we're hybrid AC, DC? The gasoline is carbs and the hybrid electric clean burning fuel is ketones. So when you switch to ketones, it activates the brain's repair systems. It improves mitochondrial function. It reduces inflammation. It helps cognitive function at every level. So I've seen it work from autism to Alzheimer's to schizophrenia to depression.
This is just an all-protein diet.
It's not all protein. It's fat. It's actually 75% fat. Olive oil, avocados, nuts and seeds, animal fats, dairy fats. And it basically should be a healthy version of it because you can, eat bacon and that's not a good idea. But you can do healthy ketogenic diets that actually improve health and reverse disease and work across all these things. So sugar is really driving this big problem, sugar and starch. And by the way, flour, bagel. I mean, I had a did a lecture the other day, and a woman said, I had a bagel for breakfast. And I noticed I had a glucose monitor on my sugar spiked 70 points. She's got a metabolic problem. And you can start to see when you eat these foods, your body gets dysregulated. And when you use a diet that actually shuts off these cravings, that repairs the metabolic dysfunction, that improves insulin sensitivity, it doesn't take long. So it's shocking. In 5 or 10 days, we get a 70% reduction from all symptoms and all diseases by people just changing their diet. And most people, Tucker, don't connect how they feel with what they're eating. They don't make the connection. And so they think they're suffering from all these problems that are related to what they're eating.
Why is it so hard for people to maintain a ketogenic diet?
Well, it's a very extreme diet. I don't think you need to be so extreme. Like a 10-day detox is not keto, but it does like probably 80 or 90% of the benefit. So you get to eat more starchy foods.
Well, let's just say you just decide I'm going on a keto diet from now until I die.
Yeah. Probably, what you want to do is use it to fix the problem and then come off it. We were always doing this historically because we were hunting and gathering, and sometimes we didn't hunt and gather very well. We couldn't find anything. So we would switch into burning fat because we probably have 2,500 calories of sugar stored in our muscles. That doesn't last very long. That'll last a day. But we probably have 30, 50, 60, 100,000 calories of fat in our body because we just naturally have fat in our body. And that's a great source of fuel. So what happens is the body starts to break down the fat and uses that. And that's what happens when we overnight fast or we do a ketogenic diet. You flip into this alternative metabolic pathway. And that pathway is incredibly helpful for longevity. It's helpful for reversing chronic diseases. And across all these diseases, we're seeing the same thing happen. So really, at the bottom line here is that sugar and starch is the problem in America. And it's in every processed food. It's in what people are eating every day. And people have no idea how much they're consuming. And
so if you take out all the sugar and all the starch, is that the same as keto?
Not necessarily. I mean, for example, if you can take out ultra processed food and you can stop your liquid sugar calories, if you can eat more good fats, eat good quality protein, lots of fruits and vegetables, most of our problems will go away. This is not complicated science. And so you don't have to be super extreme. But if you are in an extreme situation and you have an extreme disease on your far end at the end spectrum of type 2 diabetes, yeah, you might need to do that for a while till you fix your metabolism. So once you fix your metabolism.
Does the metabolism return to balance?
100%. I mean, yeah. I mean, you've got, like I showed you the picture last night of that woman. She had type 2 diabetes. She had heart failure. She had hypertension. She had kidneys failing. She had fatty liver. She changed her diet. In 3 months, she was off all her medications, off all her insulin, reversed her diabetes, reversed her heart failure, reversed her kidney failure, reversed her liver failing. She was on her way to a heart and kidney transplant. This is not a patient who's like just slightly broken. She's 66 on her way out. And in a year, she lost 116 pounds and off all her medication. And it wasn't through rocket science or through some great new advance in medicine. It was just through applying the basic principles of nutrition.